Bayelsa Health Insurance Scheme (BHIS) was introduced in 2017 following the passage of legislation by the Bayelsa State House of Assembly and the desire to provide universal health coverage to all residents of Bayelsa State. The executive bill was meant to cater for the health needs of Bayelsans and other residents of the state, following increased cases of maternal, newborn, and child mortality, as well as fatalities among adults and teens, overprotected illnesses, and the high cost of healthcare services in Bayelsa State.
The state of our health is directly proportionate to the wealth of our state, and that this prosperity government cannot actualize its vision of prosperity for all Bayelsans if particular attention is not given to the health sector. We must continue to collaborate as governments and indeed the private sector, civil society, and all other partners to ensure that good health care is available to everyone, everywhere in Bayelsa.
We Seraki Dixon for the initiative taking the bull by the horn to establish the Bayelsa Health Insurance Scheme against all odds. You know, it was there before, but it went comatose, and his administration ensured that the Bayelsa Health Insurance Scheme came into full swing, and then since then it's been operational. And you know, the world is going to universal health coverage, where people should not pay, patients should not pay for their health and bills out of their pockets.
If you want to point any legacy project in the health sector, you accredit to the previous administration is the Bayelsa Health Insurance Scheme. The Bayelsa Health Insurance Scheme have been able to provide increased access to care, make health care more affordable, eliminate point of payment on health care.
I think the whole concept is the concept of reaching out to the people. The policy was driven by the government. BHIS has actually changed the health narrative.
Bayelsa Health Insurance Scheme, in short BHIS, came into being in 2017, especially when the board was inaugurated on the 19th of June 2017. The necessary modalities to commence delivery of services to enrollees started in earnest. As at August 2017, the scheme was at the capacity of enrolling people into the scheme.
Generally, the feedback has been good, because for those that have gone to the hospitals to receive care, we have more of success stories.
Having this in mind, the government saw the imperativeness of coming up with a legislation to boost healthcare delivery and also encourage residents access to healthcare facilities at a very minimal rate, as this was crucial in fighting the trend.
We really worked hard at the board to earn the trust of the people. So that actually taught me that trust has to be earned. And once the buy-in came, it became different. The health-seeking behavior improved dramatically. That if we look at our health indices before BHIS and today, and what it is now, definitely I know that a lot has happened.
The statistics we have, the health-seeking behavior of our people before the advent of the Bayelsa Health Insurance Scheme was very poor. People really go to the hospital when they are sick because of the cost of spending or paying for healthcare services. But from the advent of health insurance scheme here in Bayelsa State, believe you me, the number of uptake of patients in the various health facilities has increased significantly. People who ordinarily would not want to go to the hospital are now going to the hospital, and the doctors in most of the facilities are becoming overwhelmed with the influx of patients into most of our health facilities. And because the health-seeking behavior has significantly improved, directly this is going to affect the mortality and morbidity rate.
Before now, private hospitals in our states were virtually moribund. But because of access to care, our people's attitude to health care, there have been increase in health promotion. People now seek health care. People now walk into the hospital, even when they are not sick.
Before BHIS came in, we were like doing operations like twice a week. Those are the ones with major bony injuries that need major surgeries in my field. All right, but for general outpatient consultations, non-operative procedures, I see an average of 20 to 30 orthopedic patients in the outpatient clinic a day, and you can multiply that by the 7 days actually, and then you get an idea of how many we see in a week, and then of course by extension a month.
That once people are healthy, productivity, economy, everything goes up. So that is why health weaves into every other sector. The education sector, agriculture, every other sector. Manpower, people have sound minds, healthy bodies, they can give themselves fully to what they need to do. So productivity, economy, everything thrives better when you have a healthy populace.
A few years down the line, the act, which was initially rejected by most people, has now turned to a lifeline to BHIS in release, who in turn have spread the good message to the nooks and crannies of Bayelsa State, just like a wildfire in Ode.
I remember the very first time we started, and it was like, nothing is happening, don't disturb us. In short, we had to carry the whole machine down to the secretariat, and people were just passing, even as if they didn't even see us.
As a civil servant, I felt bad at first when they decided to bring up this scheme. The scheme was just like they want to use us for making money.
Well, some people they thought it's fake. Say they are just deceiving us. Hey, this hospital, they are fake. They are not giving us the real drugs. They are not giving us drugs. They are all those sorts of stories. There's rumor.
First thing that one will notice was the apathy that we were welcomed with when we went to the different offices to register people, thinking it was not going to be a scheme, that it was going to work the way it's working, relating it to former schemes that have come up and fizzled out in process of time.
The law makes it mandatory for the deduction of a fractional sum from public servant salaries on a monthly basis, making them automatic BHIS in release. But despite that, there were still uncertainties regarding the visibility of the scheme.
We have it in our law that everyone living in Bayelsa State must register either into Bayelsa Health Insurance Scheme or the National Health Insurance Scheme. Every other private health insurance scheme you have is just supplementary. You must partake or participate in these two social health insurance programs.
I started with the formal sector with civil servants who were then deducted at source for their premium, and they began enjoying those services.
My salary was at a certain level, but when I enrolled for the BHIS, there was this debit that was being done on my salary, and initially I was not seeing any need for it.
Once salary BHIS came up, or the cutting or deductions started, it's like, one salary cannot take one home. Why are this deduction and all that? It was painful initially, very, very painful. By the time you see the gains of what policies the governments introduce, you will now say, oh, thank God.
The bulk of the patients that we have, that we're handling, is from the formal sector, that's the civil servants. That's the good thing about the way we started, because we started with formal sector, where deductions are automatically done from our salaries. So that forms a very good background, so we can bear some of the other costs that come in.
Services provided by BHIS include outpatient care, pharmaceutical care, diagnostic test, maternity care, all preterm premature baby care, consultation with specialties, hospital care, high examination and care, dental care, a range of prostheses at a shared cost, annual medical checkup unrelated to illnesses, and preventive care including immunization, health, and family planning education. These are divided into primary healthcare level, secondary healthcare level, and tertiary healthcare services. The primary healthcare level entails access for common injuries and ailments, which include internal medicine, surgical procedures, maternal and child services, health education to prevent and control health problems, essential drugs from BHIS accredited pharmacy providers, accident and emergency services, eye care services, mental health services, and laboratory investigations.
For the hospitals, there are criteria we set in place to bring them in. If you don't meet those criteria, you cannot be brought in to give services, because you must be at a level that you can give the necessary quality services to the people that are enrolled into the scheme. And so what we did was set out the criteria, which involves your environment, even the walking into your hospital, the reception, your different laboratories, your emergency tables and trays, your theater, in case you are having a secondary service for surgeries, your clinics, and your bed space and the number of beds you have. Then beyond that, we now go to the quality of staff and the number of staff you have that can give the necessary services. So all those things are pegged, and so you can't go below that and receive accreditation.
The secondary healthcare level offers specialized care on referral and services covered by the fee-for-service, and these include surgical procedures, internal medicine, HIV and AIDS, pediatrics, obstetrics and gynecology, dental health, ophthalmology, ear, nose and throat cases, physiotherapy, radiology and ultrasonography, and emergency care.
For those that are qualified for secondary services, all the specialties, you must have very qualified staff who could offer those services in your facility before you will be accredited for those services.
On the other hand, the tertiary healthcare services entail services covered by fee-for-service, including all cases and procedures that cannot be handled at the secondary level, except a few items on exclusion list.
There are also some services that are not even in the national that we had also included, because we were like, what are the things? If we just to go and treat malaria, how do people feel? But if somebody has stroke, what is it that we can do for the person that will make them to realize that, indeed, being a part of this has helped? And that's why we have things like the MRI. Also, we have the CT scan, and then for the newborn, in terms of echo. So some few things in terms of therapy, oxygen, because incubator care. So because those are the key things that actually, like if a woman just has a preterm baby, she's looking at this baby may be in the hospital for maybe like 6 weeks, 8 weeks, or maybe so in some cases 3 months. How is she going to pay? So outside the fact that she has a preterm, she's also thinking about the financial implication, which BHIS takes off the whole.
Major procedures, even in the highly specialized fields, become affordable to the majority of Bayelsans. Really. So BHIS has been of great help.
Because there is this good mutual benefits with the hospital and BHIS itself. In this unit, we do mostly of operations.
Innumerable number of surgeries, cesarean section. You can imagine how much that will come to in physical cash.
And then we go to hospitals to look around and see how services are being provided, to be sure that patients are being taken care of properly.
This wide range of quality healthcare services have culminated in success stories for BHIS enrollees who have since seen the imperativeness of telling others about the scheme, which is second to none. Here, we have successful cases of preterm delivery and cesarean section handled by the scheme.
I'm a civil servant, and I registered for the BHIS myself and my wife. And that money being deducted, because my salary was at a certain level, but when I enrolled for the BHIS, there was this debit that was being done on my salary, and initially I was not seeing any need for it. It so happened that my wife became pregnant and we needed some medical attention. But at the initial stage, we actually went to the said hospital. So immediately we worked to move our BHIS from the clinic where it was to the Toby's clinic. My wife went in for a preterm delivery of our twin baby boys that you can see, and it was very difficult times for us. To our greatest surprise, everything that needed to be taken care of, let me put it that way, was actually taken care of by the BHIS. From the operation to the medication to, in fact, even the first few days of our stay on admission, it was also taken care of by the BHIS. The one that actually blew our mind was when our children had to stay in the incubator because they were preterm. So they stayed in the incubator roughly 35 days, if I may say. So on the day of our discharge, it was surprising to us actually. They told us that we can go, just like that. And because it coincided with a time when one of my close friends, also his sister also had this issue of preterm babies as well in another facility. They actually spent over 1.5 million thereabout. And they didn't even stay up to 30 days. Theirs was about 10 days or so. But to my greatest surprise, we left there without any payment.
My delivery process was actually awesome. Like they say, you never know the exact date. So I went for my normal antenatal on the 27th of January, and after the antenatal, the doctor told me that, "Madam, you will be born again tomorrow." And I said, "I'm already born again." He said, "No, I don't mean that born again. I mean, you are going to have a baby again." He said, "And that will be tomorrow." I said, "Why?" He said, "Because your baby is ready to come." I said, "But I'm not prepared. I don't have money. My husband is not in town." He said, "Don't worry about that. You don't have to bring any money. In short, we are admitting you right now. You are not going home." So as I got home, packed my baby bag and came back for admission that same day. And the next day, that was it. I had 3 children and the 3 are CS. The first was not BHIS, and we spent so much. And after then that I got involved in the scheme, the second was just awesome. The scan was free. So the scan doctor said they have to do it immediately. And through the BHIS, even the scan that told me that report was done free.
I work in GSTC Okaka, Government Science and Technical College. You know, when you don't have money, you will be shaking. Even your heart, you will be thinking, where do I get money to do this CS? So if they told you that it's a CS, you have fear. But this one, it's just like someone is doing it for you free and fair. You have rest of mind to do it peacefully. And I signed it by myself without my husband. I give the doctor the time that he will do it. Along the line, when I enter into the theater, I was speaking with you inside the theater. He said, no problem. Your wish is my command. Along the way, then bring out the baby. That is how I did my operation successfully, fully, no pain of drugs, everything. They take care of me very well as their patients. All my 2 CS, I don't spend money. One is for fibroids, one is for delivery of baby. I don't spend any money. BHIS on a 2 months because on a try for me well, not be small kind thing.
The scheme has also handled a great number of hydrocoleptomy, myomectomy and breast cancer cases, all executed in Yanagwa, Bayelsa State.
At first, when I go test, that was 2002. I seen a growth, so but no money to do the operation, so I no fit do the operation that time. 2020, as we get opportunity, but what the governor do for us, I can't go hospital. When I reach, they check the situation. They say the problem don't they pass. Be careful. Say if I don't do the operation now, if it cause cancer, they book me for operation. And when I go, they do the operation. I was saved. This scheme don't help me. My husband, to 2018, they admit and they are fireborn. They don't take 1 naira. That 2018, my son do operation there too. We not spend 1 naira. When I go this time, I ask them. They say that operation will take 500 and something thousand. Which, as I did today, I know if you bring out 300,000 self to do operation. So with the help of the scheme, I will do the operation.
Well, this is a situation I managing with for over 6 to 7 years. You know, fluid going into my scrotum from the body system, probably from an opening. It is not hernia, neither is it appendix, but an opening in the body that allows fluid to go through the scrotum. Over time, it's enlarged, and I've been like extracting it with syringe from my uncle that is a medical doctor who has been assisting me over the years. But when it got to a point where he's ill and couldn't handle it anymore, and it has become a huge challenge to me that I need to get this off, like do this permanently. I went to Matrix Med. First they told me I'm gonna pay 120,000 naira, but if at much they can do for me is just 100,000 naira. That's what they said. But here am I through this BHIS scheme, without paying anything, I get it done.
Sometimes my husband just leave me, travel away, enter grave. As I enter grave, I think say, as you don't go, how you go do? I can't feel some seed in my breast. I think in a boil. I'm going to take water, they press some, they call it a boliki, they rub balm. From a boliki, enter the hot, and they use the rub balm. No way. The boy don't tire. One day I just say, man, today we the travel. They run me until go enter the theater. I say, oh.
As my mom, they go through the sickness now. So when I can see the struggle, they suffer holding me gone. Nothing come out for the area. Every area was tight. I don't know my uncle and my doctor can give me some exposure. Bayelsa Health Insurance, they make I can go register. I say okay, no checking. 1 month small cash in demand. I go. When I go, I do the payment, do everything. I then take car for the operation, which was on April 29. So even the operation, everything still go well. I still like their settings, then package me well. Even when I been even get money saved that period, the doctor then still understand, put things in place for me. Thank God for the safe success on the operation and then too.
Also, cases of fractures and inguinal hernia, among many others, were executed by the scheme.
I was in the Post-Primary Schools Board until I got retired as a director in one of the zones. And after retirement, I came to experience a knee problem arising from arthritis. I battled with it at FMC until there was no solution. So I had to go and register with the BHIS just for that purpose. After registration, I went to the hospital, to the Glory Land Hospital, where I was operated upon. And after the operation, I felt better than before. For the period I stayed there in the hospital, for the period of 3 weeks, I saw the spirit of friendliness overwhelming them till I left. The money that I supposed to pay, I really didn't pay. It was charged to government under the PSI scheme. That's just it. I never paid personal sum for whatever reasons. They don't pay, they don't charge me anything. But it's a free scheme. It's quite a free scheme, and I think it is quite interesting.
I was having a near problem. It was on January. Bayelsa Health Insurance Scheme, I registered at Toby's Clinic Service. So it was on January that I went to that place and I told them that I'm having a near problem. They said I should come after 4 days. So because of, I was afraid to, so I didn't go. So later they called me back. They used their phone to call me back that I should come for my operation. It is 4 persons. It's 4 persons that are doing a day. I went there for my operation and it was successful. They did it, but they said it was so complex. I did not pay a dime. So this is a very good scheme. I didn't be in that private hospital. I didn't be in. It was money for me to pay. I would have paid even more than 200,000 naira, but I did not pay 1 dime.
I have to be the staff of a post-primary schools board. That's where I was till I've retired. I happen to have appendix. I decided to come to where I rest. I know BHIS at the Koki. I didn't know that it's going to be free all through. You see, it's better for you to try and see what the system is going to look like. And immediately I tell the doctor, after I've taken the necessary things, they examined me, and they said that the doctor said I should come tomorrow. And finally, they operated me without a dime paid to the hospital or to the doctors. I don't spend 1 kobo from my money. God made it, as Seriake Dixon has made it, and the present governor is continuing with it. I pray that God should bless them.
I'm a beneficiary from BHIS, what God is using them to do in Bayelsa State. I registered with them, and indeed, God used them in my life. When this my case, fibroid, come up, that was when I really know indeed that they are God sent. And that period, nothing was with me. I now found out that indeed my going to register with BHIS is to the glory of God. During my stay in the hospital, by the special grace of God, Grace Hospital, they really took care of me.
From the inauguration of the board to date, the Bayelsa Health Insurance Scheme, BHIS, has enrolled over 100,000 residents of the state. This has greatly reduced the mortality rate of the state, following a paradigm shift, as those who could not ordinarily afford healthcare services or who cared little about their health now see BHIS as a priority.
Especially for the civil servants, no matter what it is, you don't have to wait until your salary is paid. At any given point, it can be it's morning, afternoon, midnight. I've had people even 2 a.m. go straight to the hospital of their choice. That's another thing that is different. People were allowed to pick from where, and it's amazing because now even private hospitals that normally you expect that the low income person will not be able to access, they now can access that. So that also gave them that power to pick. And then also the fact that if you are not comfortable with the services, you can change.
First number of people we were able to register, we are just about 8,000. We are begging people to come and register when we went to the different offices to register them. When they discovered the following months that those people that have registered were able to attend hospitals and receive services without paying any money at the point of care, people started rushing in to register. And since then, registration has continued to climb. Towards the end of 2019, we had done substantial registration of the civil servants, the formal sector in the state. And so far, our total registration base, as at the end of 2020, is 116,766. And as at the last capitation of last month, is 119,342. And on daily basis, people are coming to register either as civil servants who were left out during the other previous registration, or as private individuals or corporate organizations who want to buy into the program.
BHIS first kick-started with civil servants of the Bayelsa state as a release, but today it has recorded a massive enrollment of people from the informal sector, which forms a large percentage of the state's residents, and it is still open for all. From radio programs to documentaries, flyers and mouth-to-mouth information, BHIS has continued to grow, offering top-notch healthcare services to its enrollees.
So the next phase, as far as we're concerned, will be that of reaching the hard-to-reach areas.
To try and bring out packages and programs for the Bayelsa Health Insurance Scheme that will focus in particular for the private sector, which is the informal sector. So the informal sector is very, very important in a health insurance scheme like this because 80% to 90% in some cases of the population in every state, in every country is made up of the informal sector. We're at 1,000 today, but our goal is to get, at the end of the year, to get at least 100,000 people by next year to triple those numbers. So one of the things we've seen, the numbers keep doubling almost per month because people see the benefit. And once they begin to use it and tell their neighbors, it's like a testimony. They begin to see that, look, this works. We've done surgeries, we've been an admission. We only paid 17,400 for the private sector. You don't need to be a civil servant now. You can be a trader, you can be self-employed, you can be a keke driver. You can be anybody to access it. And you don't even have to be from Bayelsa. All you need to do is to be a resident of Bayelsa State.
And the law that has been passed gives us that every resident in Bayelsa State must be. So we're looking at maybe children who are going to school, as they are presenting, they have to present to make sure that they are already insured in the health insurance scheme, the motor union and all that. We've done a lot of talk even to the churches and all that. I think to some extent, I think it's a success story because the kind of negative attitude they had at the onset, that has changed dramatically.
The scheme has encouraged the development and sustenance of hospitals and other healthcare facilities in the state since its inception, with over 2 billion naira directly paid to hospitals by the end of 2020.
As at the end of 2020, we have spent more than 2.2 billion directly paid to the hospitals from Bayelsa Health Insurance Scheme, directly. Capitation was more than 1.5 billion, and fee for service was over 690 million. So the hospitals do not, again, have excuses of we don't have money to improve ourselves, pay staff, and all those kind of things. So most of the hospitals are doing well, and it is a testimony to the scheme.
But with BHIS, as it came in, pulling resources together in form of capitation has made healthcare, even major operations, affordable to the majority of Bayelsans.
In BHIS, you see promptness in payment. Every month, you get an alert. They pay you for the services. You know, we have the capitation and the fee for service. Unlike what you have in other insurance platforms where you're being owed for months.
The Bayelsa Health Insurance Scheme is doing so well. And then we have all our data, we have all our information people can see. We have credible people, our books are open to auditing all the time. So whatever money is coming, you can be sure that those monies go in strictly for health services.
Like every other scheme, BHIS has suffered its challenges occasioned by the incessant inflation and constant devaluation of the naira. And service providers say there is need to reform the scheme to meet the current economic trend.
You know, this scheme is made of 3 stakeholders. The supervisory body, which is the BHIS office, the contributors, who are the enrollees, while the service providers, who are the facility as an hospital. Yesterday was not today again. Cost of things have increased. Drugs are no longer how much we're buying these drugs again.
One thing we point out as a challenge is most of the drugs we use for patients here, they are not just ordinary drugs that we can get outside the street. Most of them we order for them.
The amount of patients we see and then the finances is not enough. So we end up running out of drugs.
The billing guard is long overdue for review. Some bills have remained stagnant. Nothing, only the air we breathe from God remains stagnant. Every other thing has increased. We've made representations to the BHIS office to review those bills, especially the major operations. The doctors we call, they've increased their bills. The implants we use, the fees have increased. The drugs are directly related to foreign exchange because most of the drugs are produced from outside Nigeria.
As I speak to you on a daily basis, we sit down to evaluate our activities. We have done drug price evaluation once. We are doing the second one now because of inflation. And we are bringing all the drugs to the present market price and then with markup. In our past interactive session with healthcare providers, those things were brought out. So we are doing it now. Increase in tariff. And now tariff, apart from the necessary consumable, tariff is negotiable. So they sit down and then say, if you are doing this service, what is the cost of the service? Apart from the consumables that are used in the service. Because the consumables can be priced. From the market price, you can price the consumables. But the service, which is the skill, cannot be priced. So you now have to negotiate on what is the demand, what is the supply, and come to an agreement of the price. So those are the things we are doing to try to correct all of that.
Despite the legislation backing up the scheme, other sustainability measures are put in place to ensure that the scheme survives successive administrations to be able to achieve its vision, which is having a strong, dynamic, and highly responsive health insurance scheme that is totally committed to providing easy access to quality and affordable health care in order to improve the health status of residents and citizens of Bayelsa State.
I want to commend His Excellency Senator Doyediri, the Executive Governor of Bayelsa State. It's not easy to continue with some other person's vision. And we must commend him for these various structures and policies we have put in place to ensure that we sustain this field that is very beneficial to Bayelsa. And like I said, he often say he will never play politics with the health of Bayelsans. Now, when he came into office, the Bayelsa Health Insurance Scheme had a mushroom office, and by the special grace of God, he has approved fund for the construction of a gigantic Bayelsa Health Insurance Scheme complex. It's ongoing now.
We would want to plead to government to be faithful in their own equity fund that they provide, so that way we can plan more. You know, you can only plan with funds that you are sure coming.
Innovative ways of getting funds, that is part of the mandate.
The sustainability of every program is critical, and that's why in the scheme currently we have ensured that there are modalities to ensure it continues regardless of whether there's a new government or not. And let's not forget that the funds that we get in BHIS is contributed by the people. What government does is to put regulations in check to ensure that there's sustainability. So there's also a standard of practice for the healthcare providers. BHIS, it has transited from one government to another, and it will be forever. What we've done is to bring in institutions and systems and structure so that if anyone leaves in BHIS, it will still continue because systems have been put in place.
And as the state strives to achieve quality and affordable healthcare services that is easily accessible to all residents of the state.
There are discussions to see how, instead of you paying out of pocket, why not have a clear-cut insurance system and say, okay, I'll be able to insure 100 people in my constituency this year, and you pay the fund, ask that you want to pay it, and the people get the benefit.
So the next phase, as far as we're concerned, will be that of reaching those areas, the hard to reach areas.
We are at a good stand to give them the best services that they will ever get in medical service. We are encouraging them to come in and then register.
My encouragement to all Bayelsans, and indeed all residents of Bayelsans, whether you're Bayelsan or not, is to ensure that you enroll with your family.
We need everybody to come in, as many of us just come in, so that together we can work to ensure that we are all healthy, and then productivity of the state, the progress of the state can move forward.
BHIS is committed to the health of all.
I over happy. If no be BHIS, maybe we for owe plenty credit. Because that time no money no even there one. If no be them, I for no sit down here they talk today. So as I reach that hospital, to themselves, just take care of me, no even look back, take care of my children.
Care was so great. It's a very glorious experience to come out alive and see your children. Because of what I experienced, if I'm to pay, I will still be in debt till today.
My heart is overjoyed when I think about BHIS. BHIS, now Papa.
BHIS, you are superb.
BHIS are not too much.
BHIS,
try well.
Too much.
BHIS, committed to your health needs.